Hi, my name's Hannah Powell. I'm here with Ashley Crabtree, Jenny Iyer, and Amy Ward. This is our health promotion program called Wellness Through the Scope of MECFS. MECFS stands for myalgic encephalomyelitis, chronic fatigue syndrome. This is a long-term illness that affects more than 4 million people within the United States. Although about 90% have not been diagnosed, this is because there's not a lot known about this illness and it's quite stigmatized. Patients with MECFS experience a lower ability to do usual daily activities. They also experience extreme fatigue, post-exertional malaise, dizziness, confusion, memory problems, depression, stress, anxiety, muscle and joint pain, headaches, and sleep problems. During post-exertional malaise crash, symptoms worsen, and patients may be homebound or even bedbound for an unknown amount of time. This can range from weeks to years. We were able to partner with the Bateman Horne Center. They're a nonprofit organization located in Salt Lake City. They conduct research and treat individuals with fibromyalgia and MECFS.
Our group conducted a thorough needs assessment through surveys, and we were able to use the Bateman Horne Center population of both their patients and other participants of their online support groups for those who have MECFS. And we created an intervention based off of our results from our needs assessment. We found that the categories needing most attention were part of a wellness spectrum, including relationships, home environment, meditation and spirituality, and movement. We titled these 4 categories Facets of Wellness. Our program lasted 6 weeks, and we conducted a 1-hour Zoom online conference session every week for the course of those 6 weeks. Our participants are located all over the US and even Canada, as majority of them are homebound and some even bedbound. Our first session was an introduction to the program, where we went over the content of our program and got a better assessment of the individual personalities and needs of the participants. Our second session, a week later, focused on relationships and how to develop and maintain healthy relationships with oneself, family, and significant others. The third week focused on the home environment, discussing the importance of planning your day according to your own personal energy envelopes. The fourth week was meditation centered. We discussed the benefits of meditation while experiencing chronic illness and followed that discussion with a guided meditation. The fifth week centered around movement, and we focused mainly on isometric yoga for MECFS patients, followed by a guided recumbent isometric yoga practice. Lastly, our conclusion session wrapped up all of the content where we received participant feedback and testimonials. We then explained the packages that we were sending to the participants that were full of materials that they could use to continue to practice the information and other movement and meditation practices that we worked on during the program.
Before and after implementing our program, we asked the participants to rate their relationships, home environment, meditation and spirituality, and movement on a scale from 1 to 10. 1 was being poor, 10 being excellent. We had 12 people take our pre-program exam and 8 people take our post-program exam. The other 4 had just dropped out as a course through the course of the program. Our impact evaluation proved that our participants' relationships improved by 16.07%. The participants' perception of their home environment improved by 16.39%. Their meditation and spirituality improved by 4.41%. And our greatest increase was their movement, increased by 152.38%.
To conclude, this program, Wellness Through the Scope of MECFS, was successful in improving multiple facets of these participants' wellness. Overall, they improved their coping skills with their relationships, home environment, meditation and spirituality, and movement. We were able to positively influence all of these facets of their wellness and give them resources that remain relevant to the classes we taught to improve their overall wellness. In addition to the education that they received, the $1,000 grant that we received from the University of Utah was used to purchase and ship wellness packages all throughout the country and even to Canada. These packages included several resources and tools, including a yoga bolster, coloring book and coloring pencils, resistance bands, essential oils, Epsom salts, a meditation guide handout, and a SMART goal handout. These were all resources that we felt the participants could utilize throughout the rest of their wellness journey in order to improve these certain facets of their wellness that we worked on with them. During the conclusion session, the participants expressed gratitude and appreciation for the resources and support that we provided. The program was well received by both the Bateman Horn Center as well as the participants.